Hi, everybody. This is Craig from the University of Applied Research and Development. This is our Emergency Response and Risk Management podcast. I'm delighted to have with us, after a very busy Monday, Sonia Singh, who is the City of Markham Emergency Preparedness Coordinator. Hi, Sonia.
Hi, Craig.
Delighted to have you here after a busy day.
Thank you so much. Actually, it was a holiday here, so it wasn't so busy.
Wow. It's a nice way to start the week when Monday's a holiday.
Yeah, I know, right? Exactly.
Hey, so tell us about your current role, City of Markham, and what you're doing.
So I'm the emergency preparedness for the city. The city is approximately 360,000 people and growing. I am the only emergency preparedness coordinator for the city, only person responsible for the emergency management program. In Ontario, Canada, we have legislation that requires municipalities to complete certain aspects of an emergency management program, and it requires a lot of work, especially for a city as big as Markham. So the legislation states that we have to have an emergency response plan. We have to have emergency operations center that is fully operational with telecommunications. It has to be a centralized spot where we do our communications and coordination. We have to test our emergency plan once a year. We have to have certain meetings, and we have to provide training. And we, meaning me. So it is quite the task. I've been in this role for since 2010. It's been 10 years. And starting off, my background's actually in public health, so this time is quite interesting for me, especially with the situation the world is experiencing currently. So it's bringing me back to my roots in public health.
Sonia, you're in Canada?
Yes.
And is it common throughout all of Canada with legislation that states you need to have a plan, a centre, and testing and training?
Yes. Different provinces would have different stipulations in their legislation. I can't necessarily speak for all of them, but I'm pretty sure that every single one of them says you have to have an emergency plan, every municipality. In Ontario, there's 444 municipalities. Each one, up to the smallest, tiniest municipality, has to have an emergency plan and abide by the Emergency Management and Civil Protection Act. So even if you have somebody who is a fire chief or police chief, or if you have a mayor, if they're the persons that are designated to run the emergency management program, they have to do exactly what I just told you. They have to complete that entire program. The Ministry of the Solicitor General, which is in Ontario, that runs the emergency management program or is responsible for the emergency management program, they conduct an audit every year. So we have to submit information that we've completed all the requirements under the Emergency Management Civil Protection Act. So it is legislated. There's a program. There's restrictions. We have to provide it. Otherwise, if something like this, for example, the pandemic happens and we don't have an emergency plan, then the municipality is at risk.
Right. So in 10 years, you must have seen a number of things that have happened. So share with us some of your experiences.
I've been in the public sector for about 23 years, and it goes back to me starting in public health. I started in public health in the 90s and late 90s, and with that came outbreaks, like infectious disease outbreaks. I used to be the infectious disease coordinator for a municipality in in Ontario. We have municipalities, and they are two-tiered. There could be like a municipality and then a region. So our public health department was part of the region that I now reside in Markham. So I worked for public health, and we saw SARs during that time. And that got me interested. Actually, it was 9/11 that got me interested in emergency management. So it started way back in 2001, and with the Anthrax, potential Anthrax scares, the suspicious white powders got public health involved. And it wasn't until SARS happened that they, meaning public safety, started to see public health as also a first responder. And it was really interesting to see how we got involved from a public health standpoint, because now you don't have a site. You have public health outbreak that reaches beyond borders. So it wasn't something that was very easy to comprehend, especially in the emergency services, emergency management field. So it began the thought process of having public health as a responder per se. So that was interesting, and that got me involved. And then in Ontario, actually in the eastern seaboard of North America in 2003, the same year that SARS happened, we had the power outage that lasted over a week, and it was quite significant. And again, I was still in public health, but that allowed me the opportunity to work with first responders. We had to coordinate our services. There were a lot of issues like, food safety, for example, is part of public health. And with power outages, you have food issues. Food safety issues. We also had things that happened like at long-term care facilities, elderly homes, where sewage systems would be, would be failing. So we got involved in that respect. So for me, going from public health into emergency management, that was the transitioning period. And I thought, this is pretty cool that you have all these organizations, all these agencies working together for one purpose. And I found it very intriguing. The only thing that was different is that I didn't understand the language that everybody spoke, in the sense of risk mitigation and risk assessments in that respect, and the incident management system, all those things that public safety professionals would talk about, I didn't understand because I came from a public health background. So I decided to go back to school and learn that language. And I chose a college program versus a university program, only because of I have enough university time spent. I didn't want to do that again. So I wanted to go the practical route, and I wanted to learn from professionals in the field. So I took a 1 year, and I did a certificate program with one of the local colleges here that's quite well known in emergency management in Ontario and across Canada, George Brown. And then from there, I decided to leave my job in public health, and I went to Toronto. And in Toronto, I was the emergency planning coordinator for the pandemic influenza team. And there was a group of us working together. And so, of course, I went there in 2007, 2009. We had the pandemic, so that's another piece of the of experience that I had. Again, with an infectious disease, it seems like that's my thing. And working in 2009 through the pandemic, learning a lot about assessment centers, vaccination clinics, organizing those things to happen within the city, within our team. That was great. And then I moved to City of Markham because, again, I wanted to have experience working at the municipal level where I touch upon all aspects, not just public health, but the other types of emergencies, the natural disasters and the man-made disasters, explosions, what have you. Like, I wanted to prepare a city for emergencies. And so I decided to make the move to a municipal emergency management program. And that's where I've been. Since then, I have, in Ontario, we hosted the Pan Am Games in 2015. So that was also a lot of work. So here's an event that we had to plan for and coordinate as we would an emergency. So that was an experience that I'll never forget. 5 weeks working in an emergency operations center, or what we called it was a municipal coordination center. The other part is that in Markham in 2013, and in small areas, a small patch of Ontario, we had an ice storm. And that was the first real emergency in the city of Markham since I started. So it was a great way to test the plans that I put in place over the first 3 years, and also the training. And what came out of that was that the city recognized that you should have a proper system in place to coordinate, and that was the incident management system. So I trained our staff at the beginning. We introduced the incident management system in 2010 to Markham, and we had 3 years of training, and we implemented it, and it worked. And that was, I think, to me, one of an important moment, because you see your work actually being applied and seeing people actually get it. So that was quite encouraging. And now in the past few years, what we've decided to do in the city is practice. Like, we don't wait for emergencies to happen. We actually practice by starting something called enhanced monitoring. And what that is just a small activation. So anytime we have a storm that can happen in the city, we start coordinating with a small group of people so that we keep the practice, we keep the documentation going, we have situation reports that go to our elected officials and our senior management to keep them abreast of the situation. And in that respect, we have a presence even when there isn't a big emergency. So people get used to hearing from us, they get used to the communication that comes from the Emergency Operations Center and our emergency management team. So in the past few years, we've been doing that. And then now we activated our enhanced monitoring in January. So we didn't have a case in Markham until March. Our first case wasn't until March, but we were doing enhanced monitoring since January. And as soon as we heard that there was a potential case in the city of Toronto, we implemented many protective services in terms of, we had all our buildings equipped with additional hand sanitizing units. We had, this just right off the bat, the first couple of days, we had extra cleaning happening in our buildings. We had communication going to our community in multiple languages. Markham is very diverse in terms of the population. We have a large Chinese, Eastern, Asian population, and it's quite a nice mix, actually. So we provide information in multiple languages, and we got through them. And to be honest, it's again reassuring to know that getting information out and that communication out right off the bat has helped us to keep one of the lowest community transmission rates in the GTA. So we're quite proud of that. And we're talking about community transmission, not necessarily like close contacts or in institutions. It's people who are walking around in the community. And compared to all the other municipalities in our area, we have one of the lowest transmission rates. So we're quite proud, and we do believe it's because we took measures real immediately to start communicating, and we have been doing that consistently since. We activated our Emergency Operations Center on March 17th. Again, the pandemic was declared, I believe it was it March 17th or the 16th? I can't remember. I think it was the 17th. So it's been crazy. And so there's that experience. So I'll stop there because I think I was rambling a lot.
No, that was fantastic. Obviously, I'm from New Zealand, but I live in Indonesia and we work with people around the world. And the Prime Minister of New Zealand just kept saying, amazing. We're going to go hard, go early. And
she's amazing.
Yeah,
really, really admire her.
Yep, she's done a good job in that area.
Yes, she has. Absolutely.
You mentioned a couple of things that I just wanted to pick up on because I've been furiously writing notes. One of them was that when you transitioned into emergency preparedness, you had to learn the language.
Yes.
Yeah, and it sounds really important when you're coming from another sector or but related. Yeah, tell us more about that.
Well, again, yes, I'm coming from a sector that's public health. It's not public safety per se. Not at that time, it wasn't. Dealing with a variety of agencies like police, fire, EMS, understanding how they operate and work, how they function, is very important. You can't come into a field without understanding the players in the field. I wanted to ensure that I understood their priorities because, again, everybody's looking after their priorities. Understanding my role and responsibility. Again, you don't want to be siloed, but also you want to swim in your own lane. So it's very important. And again, going back to the incident management system, we use it here in Ontario. It's slightly different from the ICS, I guess, incident command system. Slightly different. It's almost the same, but it is applicable, not necessarily at the site level. It's more applicable in terms of managing an emergency from a municipal or coordination position. So again, it was more important for me to understand all those intricacies, understanding the personalities and how to communicate with each agency. We saw that in 2001, the issue with communication after 9/11, in terms of the report where police were speaking a different, they weren't communicating, coordinating their communication, so there was miscommunication. So that was very important for me. So again, learning from people in the field versus academics at that time for me was very important. Currently, right now, I am doing my master's in public safety. And there is definitely benefits to having practical experience and then going into a master's. At least I have that, the context to think about and work through and critically think some of the things that I've actually done. So yeah, it has helped. But yeah, it's learning the language. It's understanding the people that you'll be working with and the relationships. Absolutely. It helped so much to have that. The other part I didn't mention is prior to getting into emergency management, I volunteered. I wanted to make sure that I took an opportunity to volunteer. And there was a program with the Public Health Agency of Canada, and they were creating field hospitals. And I got some great training through that. I learned about the incident command system. I learned about field exercises, and we conducted quite a few. There was one that we had, I think it was back in, honestly, it's so long ago. I think it was 2005 or 2006. And we had like 900 participants. It was a huge exercise that we built up for. We built a field hospital and we ran it using the incident command system. And it was fully functional. It was in the middle of winter. It was freezing, and it was a good opportunity to see, again, multiple agencies coordinate together and recognizing that there are some issues. Right now, we have a lot of issues still, even after exercising and coordinating with other agencies. There are still communication issues that need to be worked out, even from this pandemic.
Right. I think that was really important that you said understanding everyone's roles, but also understanding your role and making sure that you're swimming in your lane. I think that's quite a powerful learning for people to take up from this as well.
Absolutely. The other part is, yeah, you could swim in your lane, but you should ask questions too, because you don't want to assume that it isn't your role it's funny. It's when I do my training with the municipal staff, I encourage them, if they're unsure, just ask, because if you assume that somebody else is doing something, you could really, there could be issues that are caused because of that. And again, it's miscommunication that leads to a lot of issues when you're doing an emergency response or even enhanced monitoring. Like, I think that's so important. If you're unsure, you still have to talk about it too.
Yeah, that's good. You mentioned about doing multilingual communications because your city is quite diverse. The people that are involved, particularly with our exclusive partners here in Indonesia, which is Waguna Samson Tiara, and in Malaysia is our Wild Geese group. They have over 6,000 trainees every single year going through emergency response and risk management. And so with those types of numbers, working in the oil and gas industry and other safety areas, they have people from a range of different geographic regions, different cultures, ethnicities, and all of that. So I just wanted to pick up on how can someone be sensitive to their role and the roles of others, given it's going to be probably a multicultural experience being involved in an emergency. Tell us about that.
Well, it's funny that you say that because in Markham, again, because we are a diverse population, we kind of use that word we. We are in this together. We definitely have the messaging in different languages, but it is the same messaging. We are one. We are in this together. There is no separation between the cultures, so to speak. We're very culturally sensitive. We just try to provide the information in multilingual media. We have a lot of connections with the multilingual media in radio, etc. We reach out to all communities. The interesting thing too is we also have connections with our faith organizations, reaching out to them to provide information to their congregation is very important. And again, it helps us to be religiously sensitive. So we do a lot of that work before anything happens. So one of the important things that we do is we reach out to our faith leaders. Our fire services and our police services actually have a faith or places of worship tour. So we go out and meet the community, and we have a session with our religious leaders in different faiths and understand what their faith is, what, for example, especially for fire and police, if they're going into a place of worship, what to expect, how to behave, cultural sensitivities in that respect. And it's been wonderful. I have done it at least 6 times because I just find it fascinating. And it's great to meet the community in that respect. So we're invited into a place of worship, and we listen to what that religion is about, and have an understanding of how to approach certain things, their culture, their their traditions, etc. So we go to a mosque, we go to a Buddhist temple, we'll go to a Hindu temple, we'll go to a synagogue, and then we'll go to a church, an Orthodox church, etc. And again, it's like a full day. That's prior to an emergency. And these are the things you have to do prior to. It's establishing these connections before anything. So you already have those established relationships. So I think that's really key too, in terms of communication. We have established relationships prior to any emergency. So it's just an easy transition to providing the information. We also have a communication plan, and we have our templates of the things that more than likely will happen, most likely would happen in Markham, and so that we are able to communicate quickly. And again, that is having those templates in different languages. So it's all in the preparedness part, right? And again, we also practice it in our exercises every year. So our communications team, our public information officers, they have like their files that they'll always refer to. So they have an ability to, as soon as something does happen, they could just get going. So that's important. It's all in the preparation.
And this enhanced monitoring sounds like a fantastic way to keep that going, with the enhanced monitoring, practicing.
Yes, it is. It actually is. We, with our enhanced monitoring, again, so for example, if we had a potential ice storm, we would have our operations, which is our like roads and parks and staff, plus our communication staff, plus our parks and rec staff. Like they'd be very people who are more community facing, be involved and report back into us if there's any issues or problems. And then we would provide a messaging and put that out in the media, etc. We have Twitter, Facebook, we use everything, Instagram. We have a great communications team here.
This has been really, really valuable, Sonia. I do want to ask if you have some career advice for people that are new getting into the industry or fresh graduates. What would you say?
One of the things that has actually some of my colleagues and some of my friends we've talked about is that it's wonderful to have the education to back you up. Coming out with a master's in emergency management, so to speak, does not make you an expert in the field. You have to have the experience. You have to be able to apply it. I think that's very important. I think We've all done our time, so to speak. We've gathered information. I'm able to speak with confidence, and because of my expertise, because of my experience, I'm able to speak confidently. And I think that's important, is don't rush into things and think, yeah, I'm going to be an emergency manager. You've got to get the experience. Take as much time as possible, volunteer if you can, participate in exercises, get that experience, because sometimes I honestly, like I do some mentoring of students who are doing the university degrees, like they've just come from high school, they do the university degrees, they may move on to their master's with no work experience. And they have a different concept of actually how things work. And I think that's also very important. It's to observe, understand the environment that you're working in, understand the relationships, and then maybe you could start implementing things. I've had many people come and say, Sonia, why don't you do this for the city? Why don't you do this for the city? Great ideas. But at the same time, you have to understand the culture of the city. You have to understand the politics involved, and there are politics involved. So you may have all these wonderful ideas, but at the same time, you have to step back, observe, and take your time building a program. I think again, a lot of people are rushing into a lot of things, and they need to step back a little bit, take some time, observe, learn from the professionals, get that experience.
Sonia, thank you so much for your time.
Thanks so much, Craig. I know this was impromptu.